A recording. All right, so we're going to talk about the Texas Evidence Collection Protocol, and we're also going to talk about the updates to the Sexual Assault Evidence Collection Kit. Here are our objectives, just to talk about everything I discussed previously. Here is our outreach team from Texas A&M. So myself, I'm the lead of the Texas Evidence Collection Protocol Update. Dr. Stacy Mitchell is our forensic nursing coordinator. She is unable to be on the call because she's actually being interviewed by a local news station. And Yvonne Garcia, who had a family emergency, so she is unable to attend. So I don't know if Rebecca is on the call. Rebecca V is with DPS, and so Rebecca and I and Yvonne have traveled the state talking about the TRACK-IT, the Sexual Assault Evidence Collection tracking system for survivors of sexual assault. Here is all her information. And so as I'm sure most of you know, Rebecca is in charge of the DPS TRACK-IT system. And so that will go live on September 1st, and that allows people who have experienced sexual violence in Texas to track where their kit is anonymously, meaning they do not have to interact with law enforcement. Sorry about that, guys. I have no idea what happened there, but anyway, if you are on the computer plus calling in, you might get some really big feedback like that. Just want to let you know. This will be recorded and will be provided later on, so you can access it at another time. So going on, kit tracking information, of course, starts September 1st. And if we have no expectation that you stop using the kits that you currently have, you would email kittracking@dps.texas.gov and provide them with a number of kits that you have that you will need tracking barcodes for. And then September 1st, we would begin using the tracking barcodes. You would get one barcode per kit of the current kits. And then with the new production, when the new kits are created, they will have multiple barcodes in them. But to get us through until September, until we're done using all the kits we currently have, this is what we're going to be doing. Rebecca is on, and if there's any questions, we'll type them in. Or Jennifer, could you possibly unmute Rebecca? Is that humanly possible?
I don't have admin privileges on this.
So let me see if I can find her, and we will let her talk a little bit, because, you know, everybody can do a better job speaking about their own personal job than I can. I can't seem to find her on here.
She might be under RV 22903.
Yeah, and I'm just not finding her yet. So I'm gonna keep looking. Yeah, I'm not finding her. Anyway, so we'll keep going. If anybody has questions, type them in, and I will answer those questions. I'm going through one more time just to see if I can, I can unmute her. All right, Rebecca, now you should be able to talk. Or not.
Lori, can you hear me?
Yes.
Yay, there I am. Lori, I think you did a great job. I don't want to take up too much time, but I appreciate the time that you were giving me. as Lori already said, if you have any questions about kit tracking, it's fast and furious. We're trying to get out all of the kit labels, the barcodes, and the survivor cards. If you have ordered them, most of them were shipped from Austin yesterday by my amazing admin, Amanda. So you should have them by the end of the week. But if you haven't ordered, that's fine. Just get it to us this week or so, and we'll get some more printed and shipped out to you so that you have time to have them by September 1st. The other big news is if you've submitted your data user form to establish your agency within TrackIt, we are actually going to switch all of those accounts over to live next week. We're hoping the early part of the week. That way it'll give us several days to be able to address any firewall issues you may have or questions about how to kind of finalize the setup for your agency. So be looking for an automated email from TrackIt, probably mid next week. You should be receiving that. I will probably follow it up as well with an email from my own DPS email account, because once again, I'm afraid that you're not going to receive that automated email. And if you don't receive it, you won't know that you've missed it. So you'll probably get an email from myself as well as TrackIt. Those are our kind of two big items right now. So I just request and already appreciate your patience with us as we have worked through just all the different working pieces that go to make tracking happen. Thank you, Lori.
Thank you, Rebecca. I'm going to mute you again. All right, so moving on, thank you. So the Attorney General's Office and Texas A&M, of course, collaborated on this update of the evidence collection protocol. And you should be seeing a joint press release soon about the updated evidence collection protocol. So just a little backstory. We created a task force of 22 subject matter experts, and over the last 18 months, we updated the evidence collection protocol. That task force included SANES, forensic scientists, law enforcement, attorneys, DFPS, advocacy, members from the military, and the Attorney General's Office. So our process, we created a draft, and then we sent that out for public comment, and 293 amazing people provided fantastic, detailed public comments. We took those comments back and we edited it. We actually sent it out a second time for public comment to allow more people to respond. And of the 293 people that commented, 190 chose to provide their role. So 81 of those were SANE, 6 physicians. You can see everybody else here. There were a lot of forensic scientists. And so 33 declined to answer, but 100 just skipped the question, and that was me not really understanding Qualtrics well. So that was learning opportunity for me. So the task force results, based on everybody's opinions and evidence-based practice, we changed numerous things to the protocol. The main things we looked at when we were looking at evidence-based practice were the 2 national protocols. So the adult adolescent protocol and the pediatric protocol. We looked at the American College of Emergency Physicians. We looked at some NIST documents. We looked at the SAFER document. We went through many, many national protocols. We also looked at other states' evidence collection protocols for best practices. So what we came out with was it was best to concentrate evidence on 2 swabs per collection site. And so, you know, if some of you on the call are as experienced as I am, I remember more was better. We took many, many swabs. And science has shown that it's best that we concentrate the evidence on 2 swabs as the minimum, because we definitely have to have the 2, and one for initial testing and one if there's secondary testing, like defense would like to do independent testing separate. So we definitely have to do a minimum of 2 swabs. Collection of hair standards is no longer recommended. However, we left the hair standards and the combing envelopes in the kit and left that up to examiner and patient choice. So they're still there, but when we polled people across the state, almost all examiners were not collecting hair standards any longer. The collection of smears is no longer recommended, and we actually heard from forensic scientists that they were making their own smears and they weren't using ours, so we decided we were going to remove the smear entirely. And also recommended that there be no blood in the kit, because if there's blood liquid in a tube, if there's liquid blood in the kit, then of course that kit has to be at the very least refrigerated. And crime labs do not have this kind of storage, and nor do hospitals. So we're taking the blood tube completely out of the kit. We also recommended significant paperwork and content updates. So the Texas Evidence Collection Protocol, here's the front page of that, and that will go live on September 1st. It might go live later on this week, but at the very latest, it will be September 1st. It will be electronic, and so it'll be a PDF document that you can print on demand if you so choose, but we will not have paper copies like we did of the 1998 version. What I really like about the protocol is there will be internal and external hyperlinks. And so, you know, if I have a definition in there, it will hyperlink back to the definition if you choose inside the document, or if it connects to, say, a Texas statute and you click on the link, it'll take you to the Texas statute. Because we are collaborating with the Attorney General's office and we want to make this process as clean as possible, and we only want one copy of the document for future changes, the protocol is going to be on the Texas A&M College of Nursing website. The Attorney General's office website will link to the A&M one where the protocol will live. And so anytime we need to do updates, say, you know, the CDC comes out with new guidelines then and changes the hyperlink, then we will only have to update the electronic version on the A&M end, and everybody's hyperlink to ours will automatically update with that. So that was how we wanted to handle that. It is, of course, evidence-based, and so the references are cited throughout the document. There are two flow sheets. There's an adult flow sheet and a pediatric flow sheet also. So the key updates, there are the addition of the recent legislative mandates. So House Bill 616 that changed the Code of Criminal Procedure from 96 to 120 hours. That is effective September 1st for sexual assault evidence collection. House Bill 8 that changed the Code of Criminal Procedures to non-report sexual assault. If an adult patient chooses to not report to law enforcement, they now have 5 years that that evidence will be stored, and the survivor must be notified before that evidence is destroyed. And as far as the last time I talked with Rebecca, they were working out a plan, DPS, on how that survivor would be notified before the evidence was destroyed. So here are the, the content pages. So it's a 140-page document. It has, I believe, 9 pages of references. And so we have the key points of the protocol. There are definitions, there are medical terms, team members, for military and non-military patients. We have legal references to the United States Code, and then some very important Texas statutes, and then talking about from a patient-centered point of view. There's the adult protocol, and that is a lengthy protocol, and then there is the adult flow sheet. There's the pediatric protocol, which is also lengthy, and then the pediatric flow sheet. Suspects are included in there. Special considerations are included in there. LGBTQ, elderly, all those populations are listed in there. Postmortem considerations is also there. And then a couple appendices, and then there are actual figures. So looking at the female genitalia, the male genitalia, and then defining all of those. Yes, you can switch to the new form on September 1st if you would like. We'll keep going. I just want to make sure that I'm answering everybody's question as soon as you have the question. So here are the two flow sheets. I know they look a little busy, but when I go through them, they're not too difficult. They can be, you know, printed on demand and laminated if people so choose, for just a quick reference on what do I do. Most of the people on the call are forensic nurses. Of course, there's lots of other professionals on the call, but the protocol was not written with forensic nurses in mind. The protocol was written for other providers that don't typically take care of patients who have been sexually assaulted. Forensic nurses are experts. We didn't want to write a protocol to tell you guys how to do your job that you already know how to do, but we did want to write a protocol to help guide the care and treatment of people who've been sexually assaulted, and guide that care and treatment by physicians and practitioners and nurses who would be doing sexual assault exams, who might not have the expertise of a forensic nurse. So the results of the regional town hall meetings, 177 Texans came to our town halls. We had 7 of them all over the state of Texas, attendees from all different agencies. And so based on the town halls and the public comment period input, the pulled and clipped hair standards, those are going to stay in the kit like I spoke about. The envelopes are in the kit, and you can choose to use them or not use them if you so choose. Of course, patient's consent guides all of this, and if the patient, you know, you offer that option and the patient says no, then we're done. And so we just wanted to make sure that they're still in the kit and people can use them, but the vast majority of examiners I spoke to have not pulled or clipped hair in quite some time. So items that are going to be removed from the kit are all the slides, the pencil, the orange stick for fingernail scrapings. It's not recommended to do fingernail scrapings because it can actually cause micro tears and hurt the patient. And the blood top tube that we talked about. We're also going to remove the adhesive on all the envelopes. So there isn't that risk of, you know, the examiner licking the envelopes. So we're taking that off entirely, so it just won't be there. Items to be added to the kit. There is an additional underwear bag for the bra. I'm really excited about that one because we never had that before. The labs have specifically asked, please do not put the bra in the kit, even if it fits. Bras go to a different place in the lab, and so the panties definitely go in the kit, or the underwear or the diaper, but not the bras. But there is going to be 2 underwear bags in the kit for use. Hanifa just wrote, who would lick an evidence envelope? I actually did very early on in my career. I think it was my second patient ever I took care of. So we are taking off that adhesive on there so nobody would lick them. We're going to add extra evidence envelopes. We're going to talk about that a little bit later. And we are adding little tiny polyester tip applicators. they're tiny and they're like half the size of a regular cotton tipped applicator, and they can get in underneath the fingernails nicely. So I'm adding in 2 sets of those. We are adding a long list of adhesive labels that we can put on the swab boxes, and then we take those swab boxes and put them in the envelope. So things that are cost prohibitive and will not be put in the sexual assault kits are the FTA cards. As far as I know, 3 programs use the FTA cards, and they will be able to purchase those like they did in the past. And they can purchase those and put them in the kit and handle it like they've always handled it. We're not going to put a vial of sterile water in the kits because it increases the cost of the kit, but it also isn't recommended because it expires. Breathable wax-coated evidence bags are absolutely available. They will not be in the kit. But programs that wish to buy these wax-coated evidence bags for moist evidence can absolutely buy those separate. And so we are not putting those in the kits. Additional things, the paperwork, the crime labs begged us to not use the triplicate forms because they just plain and simple were never able to read their copy, because the crime labs got the 3rd copy of the triplicate and they couldn't read it, and it was not helpful to them in any way. So we're not having any triplicate paperwork. That means that facilities are going to have to make photocopies or encrypted email, or however your notification system is, to make sure law enforcement and the crime lab have the information that they need on this. We're going to keep the small swab boxes in the sexual assault kit, and we have added all kinds of labels. You'll see some photos in a few minutes. Somebody, if you're on the call, if you would let me know, some brilliant stakeholder in one of our town hall meetings had a moment of utter brilliance, and I want to recognize you if it was you. And they requested that vendors do not stuff every envelope inside of the kit because we just dump them all out anyway. And so we took that to the vendors, and they said, sure, they can just leave everything loose. So in the new kits, what you will find is your stack of paperwork, your stack of envelopes, and then a whole bunch of cotton-tipped applicators and a whole bunch of boxes. And so you will just dig out what you need, and then when you collect the evidence, you take the swabs, put them into the swab box, you label them with a patient label and whatever body part label. You will seal that up and put it right into the envelope. And so you will not have to use the drying box at all, or the commercial dryers. That is not necessary. You put the swabs directly into the box, and they will dry inside that. Hope asked, will the fingernail ones be obvious to spot? So in both kits, that's a really good question, Hope. In both kits, all the other swabs are green writing, and then these fingernail ones are in blue writing. And so I got asked that earlier. I think I'm going to make some kind of notation on the protocol that will say that. And both TriTech and Cerci, the writing is green on the other ones, and it's blue on the fingernail ones. So that's a really smart question. Thanks, Hope, for pointing that out. So the kit and paperwork changes. So like we spoke about earlier, kits that are purchased after September 1st will have these barcodes, something similar to this barcode. It'll be, I believe, 2 inches wide and 1 inch tall. And the barcode will be on 3 exterior sides of every kit produced. And so they'll be on the top of the kit, they'll be on a long side of the kit, and on the short side of the kit. So whatever way you store the kits in your facility, you will be able to have a tracking bar exposed. Now remember, on the current kits that do not have a tracking bar right now, we're asking you only put them right in the middle of the front, and I'll show you that on the next slide. There will be extra kit identifier labels in the kits that are currently being created for after September 1st. This is the survivor card right here, and that tells the survivor the Track It information for the Track It website. We left it very bland like it is. We didn't want branding. We didn't want anything that would call people to ask, what is this? And so there is the website for Track It. There is the username, which, as you can see, 1900029 matches the kit barcode. And so that's what they have. They have this crazy password that the first time they go in, they will be asked to change their password. The only people who can change the password if they forget their password are the facilities. So the hospitals or the community forensic program that help them are the only ones that will be able to reset their password so that they can go in and change it. So that card, will be in every kit made, and the username will match the barcode on the kit. So with your current kits that you have that do not have a barcode, this is where we want you to put the barcode right there. And you will only get one barcode per kit, and that's just to get us through until we have the new kits with the barcode made on them. So on the left is the Cerci kit, and on the right is the TriTech. These are the prototypes. I'm sorry about the dark. I was taking pictures in my house late at night, and that was as bright as I could get those colors. So they're a little tiny bit different on the face, but when we asked forensic scientists, what can we do for you to help with throughput? They said, make the kit boxes the same size. So that's what we did. So the TriTech and Cerci kits are the same size. They're a little slightly bit different on the top, but close enough. I pulled forensic nursing programs and said, I need everybody to measure your patient label. And Nell apparently had the biggest patient label. So they are at least 3 inches by 1.5 inches for that. So you can affix your patient label there, or if they non-report, you just write in the medical record number or whatever number you are using to anonymously identify that patient on the front of the kit. And so everything has spaces for the patient's label. On the front of the kit, we also took off on chain of custody, received from, date and time, and then received by. We took off that second date and time because we just need one for when I gave it over to law enforcement and they received it. We just need one date and time, not 2. So questions on that so far? I just want to make sure I'm not missing anything from anybody. Please type them in if you have questions. We're going to move into the paperwork. So this paperwork will be available on the A&M website. You can print it on demand. It will also be in the kit. All the usual paperwork that was previously in the kit is going to be in the kit. We added some things, changed them up a little bit, but all of this will be in the kit. And there'll be some extra things that will also be available on the website too. So this is the authorization for examination. Survivor cards will be inside the kit, and yes, they need to be handed to the patient. Yes. Okay, I don't understand this question. Is the left-sided box the new paperwork? Previous slide, let's look at that. Those are the faces of the new kits. So the Cerci and the TriTech kits, that's what the face of the kit is going to look like. Did that answer that question? Okay, Casey Duke. Survivor cards will be inside the kit and need to be handed to the patient. Yes, they will be in the kit and they needed to be handed to the patient so the patient can then sign on to track it if they so choose, and they can track their kit. Everybody else, the hospitals, law enforcement, and the crime lab all have to do track it. The patient is the only one who does not have to do track it if they do not want to. Thought the authorization for photos was supposed to be separate. So we blocked it with this line on the top and the bottom so that it is clear for the patient that they're two separate things. If you want to continue to use your own authorization, your health system feels that your authorization would be better, great. We don't want to take anything away from the amazing work that forensic nursing programs are doing across the state. So if you have your own forms, you like your own forms, keep your forms. We just want to make sure that the questions are on the forms that we created here, that you have addressed the things that are on these forms. If you want to take it extra, another step further, please, please, please do. Okay, and so on this one here, we have the kit tracking barcode. This is the only paperwork that's going to have the kit tracking barcode for future. So in the meantime, after September 1st, when we start tracking and you still have your old kits that don't have that kit tracking barcode, you can write the kit tracking barcode in there. What we did on the bottom of the pages is we wrote page blank of blank. So when you're done your whole exam, you can go back through and go, okay, this is page 1 of 10. And so when you're in court, everybody in the courtroom will be able to know we are on page 1. That was one of my favorite parts of this, was because the attorneys got so confused and we knew where we were and they didn't, or the other way around. And so we're going to initial each page and then we're going to sign the final page at the end. So we're starting with nurse things. We thought, we're medical professionals. Let's put the medical things first. So demographics, we have legal name and then the patient's preferred name. For whatever reason, the patient may not choose to be called whatever their legal name is. And so we have both of those on there. So it's a patient-centered care that we're providing. We have a checkbox for, is it a report or a non-report for law enforcement? And non-reports are only patients who do not meet mandatory reporting requirements. So normal, healthy adults who do not have a disability can choose to non-report. If it's non-report, what's the unique identifier, and the health system or facility decides what that is. We wanted 2 rows of vital signs so we could have like a check into forensics and check out of forensics vitals. Allergies, meds, everything. More room for medical history, and then more room for the general appearance. And then we wanted a whole page for the history of the incident. For those programs that are handwriting the history, we wanted a whole page. Date of incidents, time of incidents, or range of time of those incidents. Number of reported perpetrators, or is it unknown? So moving on, we have the prior to evidence collection. This section, we have checkboxes, plus we have lines. So for whatever reason, you want to describe bathe, that they bathe but they didn't use soap, whatever it is. So you could add a notation after that. We added vapes to the smoked line because we thought that was important, and a lot of our patients were vaping. And we add a swam section because, of course, a lot of our patients, just to stay cool, are swimming. At the time of the incident, we have lubricant used. We got rid of that spermicide checkbox. But what kind of lubricant? Was it the patient's saliva or the perpetrator's saliva? We felt that was important to note in there. And there's, you know, forensic significance there. We also felt it was important to be gender neutral. So we have, it was the patient menstruating or the perpetrator menstruating. We have that on there. Was there a tampon present or menstruation during time of exam is added. And of course we deleted that question about did they previously use tampons. So body surface injury, we have check boxes for no acute injury, C-body diagram, or ALS used, and then some lines in the event you want to write something in there. The anal genital assessment, we changed this one quite a bit. We have check boxes for colposcope, other forms of magnification, TBD, speculum, Foley, or gynae swab. And then sexual maturation, we added in breast. So because sometimes our patients, their breasts aren't the same SMR as the genitalia. We added some extra lines, posterior fourchette we added in, and fossa navicularis we added in. And we added NAs in front of all of them. So you have a male patient, you get NA all the way down to perineum and then start your documentation. On vagina and cervix, we also added a not visualized section because, of course, you can't always see every patient's vagina or cervix. And so we just wanted that extra documentation so we can be very thorough. Summary of findings, we wanted it to be a little bit bigger than it was. And this is the page that you're going to sign, date, and time, where all the other ones you're just going to initial. And then, so that is, you know, if you're doing an exam and you don't have to collect evidence, you know, there you have, I might add into this prior to evidence collection, I might have an NA box because if you don't have to collect evidence, I'll consider that. I need to write that down for future reference. So if we do collect evidence, here's the evidence collection page. And so we thought we wanted to make it very clear to the patients that we're taking care of their healthcare first, and then we're collecting evidence second. So the evidence collection is at the end. And so for those people that don't typically collect sexual assault evidence, we wanted these statements to be very clear for them because we felt they might actually read verbatim what is on the form. And so what we put here is for DNA testing purposes, the crime lab require the following information. And I ran that past several organizations and individuals for help on how do we do this in a patient-centered, trauma-informed fashion. And this is what we came up with. For DNA testing purposes, the crime lab require the following: the gender assigned at birth, and then gender patient identifies as, because that could be really confusing for the crime lab when they find DNA that is male DNA, but they have a bra in the kit. Does that mean that the examiner mixed up the patient's known DNA swab with the oral swab and we have contaminated evidence, or does it mean something else? And so we wanted these questions in here to help the crime lab know exactly what they're dealing with. Also, last sexual contact within 4 days. We want them to write down what's going on there. Can no injury noted checkbox on each line? Let me think on that one, Miss Gloria, because I think it's going to create issues for the chart and how we line it out, but I will definitely want to talk to you offline about that. The detailed head-to-toe assessment is going to be on the body diagram. You'll be able to document everything on the body diagram. So evidence items included in the kit, again, same with why we collected evidence. So you can check the oral swabs box, and then in brackets is 2. That's what we recommend. You collect the 2 swabs, and then say something happened and you needed to document. You have some lines that you can document if you choose to. Dried secretions or debris. We added all kinds of body parts there to check off, and then you could describe what's going on or whether you put any other evidence in the kit. And then this section, evidence items not included in the kit. So say there were paper bags or there were photos or images available or something else. And we also added, is there a toxicology kit available? And then how many gray top tubes were in that kit and how much urine, or excuse me, if there were 1 or 2 urine samples. And then this is where you can describe any articles of clothing. You can list those all out there. On the follow-up, questions are pretty much the same, except for we added this kit tracking information provided and the dishes information sheet for sexual assault survivors. The DFPS mandatory report made is yes or NA, because you don't choose no. It's yes, I made the report, or no, it was not necessary for me to make a report. Hope, will fingernail swabs be separated by left and right or all together? They'll be separated by left and right. Okay, so chain of custody and receipt of information form. So some programs use a lockbox or something similar. So we wanted to have that broken out for people to utilize, because some programs, the forensic nurse that takes care of the patient closes up the evidence, seals up the kit, and puts it in a lockbox. And then another forensic nurse releases that lockbox, releases that evidence, or the crime lab just comes and picks it up. So regardless, we wanted some kind of lockbox notification for those programs in the state that do that. Here's all the law enforcement information. This is all the detailed. And then, chain of custody, they received what from whom. We added images, toxicology there. And then the chain of custody information with, one date and time. So we can't mess up that date and time. And this is the authorization for the forensic medical assessment. So this is, law enforcement signing, yes, we want that. We thought maybe we could not have that form, but when we traveled the state, there were some programs that said, please keep that form in there. So in the future, we might remove that form, but right now it is going to stay in there. And we thought to have the CCP statute in there so everybody knows that it's right there. This does not negate that form that the OAG needs for reimbursement. That is a different form, because now facilities can send the bill directly to the Attorney General's office. That is a different form. I believe it's currently being finalized, and as soon as we have the information on that form, I assume it'll be on the Attorney General's website, and we either will have a hyperlink to it or something along those lines. So we want the A&M website for evidence collection protocol to be a one-stop shop, so everybody can just go to the one site and get all the information that they need. Questions on what's currently in the kit? In rural areas where drug-facilitated kits expire before we use them, can we send blood and urine in the kit for drug-facilitated sexual assault? My understanding from crime labs is no, you cannot. Does anybody have any different information than what I do? I'm just waiting to make sure I don't have any other information for you, Izzy. How about I continue and I will get back to you if I have any different answer on that. Because if you put it in the kit, then that kit has to be refrigerated. So somebody else has another question. If we don't release photos to law enforcement, should we have a place that shows we took them but retain them at the facility? So right here on this page, evidence items not included in the kit, photos, images, videos available. And so you can just check that box. On this page, if you actually release those videos to law enforcement, then you would put that here. Does that answer your question on that? Wonderful. Okay, I'm going to keep going, but Izzy, I'm going to find an answer for you, okay? The body and anal genital diagram. So what's going to be in the kit are an adult male and an adult female body diagram, and a male and female anal genital diagrams. There will be a gender-neutral child and a gender-neutral infant body diagrams, just like previously. And then, of course, all the paperwork we just went over, that will all be in the kit. Additional diagrams that we had commissioned will be available on our website for print on demand. They will not be in the kit. And so we're going to go through all of those now. So they're a little stretched just because I stretched them a little bit more than I should have by the looks of it. That's not quite exactly what they're going to look like, but you get the general appearance. So you'll have the adult male, the adult female. This notation down at the bottom, the copyright says that we, A&M grants health professionals in Texas permission to print, reproduce, and use the copies exactly like they are. If you're anybody other than a healthcare professional, you have to ask for our consent. So those statements will be on every diagram. There will be the child and infant diagrams. They'll be gender neutral because you're going to put a diagram of their genitalia in there also. So we changed the male anal genital diagram so you could actually see the anus and document on the anus. I also put a 12 and a 6 o'clock on both the first penis picture and the second, and then the female anal genital and the cervix picture so that you can clearly document injuries. There's check boxes on the bottom for if you use toluene blue or a speculum. We made the female anal genital diagram larger, and we made the cervix smaller. So you had some room to document. So those diagrams I just did are going to be in every kit produced. The print on demand diagrams are not. They're going to be on our website. And so we're going to have a lateral body with jazz hands so that you can document the lateral injuries. There are all different views of the head and face, the eyes. I especially love the ones on the right so you can see the conjunctiva and you know, especially with the strangulation injuries, you can print these ones on demand. The ears for child abuse assessment are what I was thinking of. The mouth, these two will be separate diagrams. So they'll be, you know, a mouth with teeth or a mouth without teeth. And I really like them because they have the frenulum, so you can see and document any injuries to the mouth a little bit more in depth than what we've been able to do in the past. Hands and feet, so you can do the top of the feet and bottom of the feet both, and same with the hands. So those are all going to be print on demand diagrams that are easily accessible, and you know, print them out and have them available if you need them extra for your patients. We updated the sexual assault evidence collection kit instructions. And again, forensic nurses know how to collect evidence. This is step by step for those people who don't typically take care of patients who have been sexually assaulted. So we have all the instructions, and I don't want to spend too much time on that because everybody knows what to do with that. Excuse me. So the envelopes, the big changes to the envelopes. There's not going to be any adhesive. There is a spot for the patient label now. I love that. We're deleting that was sample collected because the crime labs overwhelmingly asked, if you collected the evidence, it goes in the kit. If you did not, you destroy that envelope. So what's in the kit was collected. So we don't need that was sample collected question anymore. We are adding additional envelopes. So we will have one that will be for cervical, vaginal and cervical or penile. We'll have a second envelope that will be for vulva or scrotal. And we wanted to clearly delineate between the scrotum swabs and the penile swabs, because if you swab the penis and then swab the scrotum that has been close to the anus and there was anal penetration, you could contaminate that whole penile swab with the scrotal swab that was right beside the anus. And so we wanted those sites a little bit more clearly delineated. There's going to be 3 debris foreign material envelopes. I think I actually called them, I can't even remember what I called them now. Anyway, but there's going to be and 3 of those envelopes in every kit. So say you had a patient that describes the perpetrator rubbing, kissing on their necks, on their breast and their abdomen. So you'll put the neck swabs, the 2 left neck swabs in a box, the 2 right neck swabs in a box. Those 2 boxes go in one envelope. And then the 2 left breast swabs, 2 right breast swabs will each be in separate boxes in one envelope for breast. Beth, we can potentially add those gender infant, male and female infant and child diagrams. You can also, what other programs have told me was they're just going to keep copies of, adult male, adult female, male and female children and male and female infant on hand as a patient to look at. I don't use the diagrams at all when I'm talking to my patients to point out body parts. I ask them to show me on their own body. But we can consider that. Will you check with me offline, Beth, to make sure that we're supplying everybody with the things that they need to do a good job? Okay, going back. Oh, we clearly defined the patient's known DNA sample, because some places that said buccal swab, other places called it saliva. Everywhere through here, it's patient's known DNA sample, because when we talked to the crime labs, that was the #1 thing that they felt there might have been confusion, where people accidentally confused the oral swabs with the patient's known DNA. So we wanted those very, very clearly defined. Like I said, only samples collected go in the box. And if you didn't collect it, you dispose of those envelopes. Only the underwear go in the sexual assault kit. Bras and other clothing are packaged separately because they go to different parts of the crime lab. So these are the actual envelopes, the underwear, bra, diaper envelopes for Cerci and FITAC. And so there's the patient label, date and time collected by who. We wanted way more lines to describe what was in there. And then received from date and time. There's only one date and time rather than two. The crime labs asked us that we kept that chain of custody on there so that they can track chain of custody through the crime lab. So those are the two new underwear bags. And of course, there's going to be two of those in each kit now. Here are the dried secretions or debris envelopes, and the Searchy is on the left and TriTech is on the right. And so there is gender neutral-ish diagram front and back. And so you would write notes on there, whatever you want to say. You know, we'll do the same thing we used to do. We'll circle the breast, and then on the notes, it'll be, you know, possible saliva. Patient stated he kissed me there. Whatever it is that we wanted to have room, because the crime lab is like, that's great, you're collecting that swab. We don't know why. And so we wanted to have a note section so we could maybe be a little more descriptive with what we're doing. And again, there are going to be 3 of these in every kit now. So you can collect swabs from all different parts of the bodies. So this is for touch DNA, it is for saliva, bite marks, you know, if there's ejaculate in the belly button, whatever, you can use these envelopes for whatever you need. So one of the big changes that we made was we added labels. And so these labels will be in every kit. So the Searchy one are on the left and the TriTech one is on the right. I just couldn't take one picture of the TriTech one, so I had to break it up. And so you will, you know, check, is it the left breast or the right breast? Each one of these little labels it's tiny. It's half an inch tall by a couple inches long. And so when you use the little drying box, you'll put the 2 swabs in the drying box. You'll label it with one of these labels, and then you'll label it with a patient label, close it up, put it in the envelope. And so there's you can write in whatever different odd thing you need to write in, you can write that in there. But those, we thought here, there were all different kinds of ones that we knew we typically collected, and then there's other ones in case you have something else that you need to collect. What a time saver. Thank you for saying that, Hope. I'm really excited about it too. So our timeline, the protocol will be available on our website absolutely no later than September 1st. I'm guessing it will be later on this week. To answer questions about this, please email me. My information is going to be on here in a second. Our Board of Regents at Texas A&M just approved our creation of the Center of Excellence in Forensic Nursing. And so our website is here. It will be on this website where everything will be. And we will do, you know, mass blasts to everybody that we can to make sure everybody knows where this information is. The tracking will be effective September 1st. We thought we would do it all at the same time. The ongoing Texas evidence collection protocol updates will occur as things change. You know, I'm positive the CDC guidelines will change very, very soon. And as, you know, that the national protocol changes or whatever, we'll be able to make those changes relatively quick. We do not want the protocol to go any significant length of time without it at least being reassessed. And so as changes are made, there will be notifications to everybody. And so that's why we wanted it to be an electronic document. So you're always going to have the latest version available electronically. Somebody says, I'm putting patient labels on the end to seal. You do not have to seal the drying box, the little boxes that go inside the envelope. You do not have to seal those ends. That's a good question. Okay, so here's my contact information. Please know we had an email migration. My new email is charles1@tamu.edu. And there's my contact information. I am going to unmute everybody, and if people have questions, you can ask them.
Thank you.
I'm going to quickly mute everybody again. All right, everybody. So I finished that in an hour. If people would like more information, have questions, please, please, please let me know. This is a living, breathing document, and I have nothing but the utmost respect for everybody who helped and provided input, because oh my goodness, they did such a great job helping. Please email me with questions. We're going to have another webinar on the 28th, and then after that, this webinar is being recorded, and so it will be available on our website, so that if you miss some time or something like that, you can go back and look again. So let me go through and make sure I've answered that. I love the updates, very helpful, thank you. Who is training law enforcement? So there are law enforcement on the call. I opened it up to absolutely everybody. Anybody who wants to be on the call can. In the protocol, we have lots of those changes. You guys are being too kind with sending your lovely comments. I'm really excited about the diagrams. Really, really excited. All right, you guys. So I will email you this PowerPoint in a PDF, so you will have the information also. And you will get an email from me very quickly. Thank you guys so much.